In Canada, lethal injection is the primary method for medical assistance in dying, MAID, where doctors facilitate a patient's final moments with compassion. Dr. Chantel Perrott, a Toronto physician, pauses just before administering the lethal drugs to confirm with her patients, "This will cause your death. Is this what you want?" Since the law changed in 2016, over 30,000 Canadians have answered affirmatively, seeking to end their suffering. The process is designed to be tranquil. Patients typically drift into unconsciousness after the initial sedative, followed by lidocaine to minimize pain, and propofol, which induces a deep coma rapidly. Dr. Perrott holds her patient's hand and checks their pulse, ensuring a peaceful transition, often completed within minutes. Words like serene and beautiful are commonly used by both providers and families to describe these final moments. However, questions linger regarding the true nature of dying through MAID. Dr. Joel Givot, a critical care anesthesiologist, raised concerns, suggesting that certain drugs could induce sensations akin to drowning, despite many professionals asserting that no patients have expressed discomfort during the procedure. Dr. Joel Givot discovered disturbing findings from autopsies of prisoners executed by lethal injection, highlighting that the process is far from the humane, peaceful death that many states intended. Initially tasked with evaluating blood levels of the anesthetic sodium thiopental, Givot discovered significant lung damage, specifically congested and fluid-filled lungs, that contradicts the notion of a swift and painless execution. The autopsies revealed that death by lethal injection often involves a slow suffocation, primarily due to the paralyzing agent used, which prevents the inmate from breathing and manifests painful sensations akin to drowning. The presence of frothy fluid in the lungs suggested severe internal distress, with evidence of pulmonary edema found in an alarming percentage of cases. Givot argues that the medical veneer of lethal injection is misleading and ethically dubious, as it misrepresents the process as a medical act. He calls for transparency in the execution process and urges that medical professionals should not participate in executions, emphasizing that lethal injection is inherently cruel and should be discontinued. Givot's findings challenge the narrative of lethal injection as a humane method of execution, advocating for its abolition in favor of methods that do not masquerade as medical procedures. As of next March, Canada's eligibility criteria for MAID will further expand, allowing individuals with mental illnesses to seek assisted death. Meanwhile, a parliamentary committee is evaluating proposals to include minors and advance requests. Fewer than 7 cases involved self-administered MAID, with most opting for the intravenous method due to its swift and predictable outcomes. The evolution of MAID protocols began with the original law, which lacked clear guidelines for drug administration. However, the Canadian Association of MAID Assessors and Providers later established comprehensive protocols, detailing the sequence and dosages for the drugs involved. Despite optimistic accounts from providers, reports of complications remain, typically concerning access, but distress during the procedure appears absent. Critics argue that non-monitored MAID procedures might mask any potential suffering, leading to calls for more transparency regarding patient experiences and drug effects. Notably, a recent study evaluating lung health in individuals who underwent MAID found no significant issues, counteracting claims of lung damage often associated with high doses of anesthetics like propofol. Currently, the discussion continues surrounding the ethics and implications of MAID, especially concerning vulnerable populations. Dr. Givot, despite opposing the methods, calls for more investigative studies to ensure a clear understanding of patients' experiences during assisted dying.